Hello, welcome back. Let's talk about a topic that came across in my clinic last week. Patients usually walk into the clinic and ask, can you please check my thyroid? I think I have a thyroid problem. So in that generic term, what is a thyroid problem? There are two very well-known thyroid conditions in which people have thyroid disorder. It could be underactive or overactive with or without the presence of antibodies. Antibodies are basically the protein molecules that work against your thyroid gland and cause your thyroid to become less active or hyperactive, which causes you to have hypothyroidism or hyperthyroidism. When you have antibodies in your blood that is attacking your thyroid gland and causing your thyroid to be underactive or overactive, that condition is called Hashimoto's thyroiditis. Those antibodies, these are usually two antibodies that we check in your blood, which are called thyroid peroxidase antibody and thyroglobulin antibody. So if you go to your doctor and ask them to check your thyroid, make sure you ask them to check also for thyroid antibodies. That is extremely important, that you should be screened, and everybody should be screened for Hashimoto's condition and thyroid antibodies, because if these antibodies are present in your blood, even if your thyroid hormone level is normal, these antibodies are causing damage and harm to your body. So what happens when you have an underactive thyroid, which is more common than hyperactive thyroid? Underactive thyroid is called hypothyroidism, and the inflammation and the inflammatory condition of thyroid is called Hashimoto's thyroiditis. Hypothyroidism is basically the thyroid when it is not producing enough thyroid hormone that your body needs, and hyperthyroidism is when your thyroid hormone is producing too much thyroid hormone than your body needs. Of course, the extremes of both conditions are going to be disastrous and are going to cause problems in the body. So let's talk about what happens when your thyroid hormone levels are abnormal, too high or too low. Usually it starts with your weight gain or weight loss. If your thyroid is underactive, usually you gain weight, and if your thyroid is overactive, you can lose a lot of weight. However, sometimes you can see weight gain and weight loss in both conditions. Your sleep will start getting interrupted, you have sleep problems, or you just start either sleeping too much, or you have sleep difficulty and you cannot sleep at night. You have muscle pains and aches because your muscle weakness develops. It causes you to have depression and fatigue and anxiety and irritability because you're just not feeling well. It can cause your hair loss and your hair become brittle and thin and weak. Your nails can become thin, brittle and weak and start breaking down. You can have bone pain and joint pain as well. You can have diarrhea or constipation. You can also have abnormal menstrual period in women. Usually thyroid directly affects your periods, and controlling the thyroid hormone and thyroid levels in the blood can actually normalize as well as regulate your periods. Basically, it can also cause numbness and tingling in your feet and in your hand, as well as there are so many other symptoms that people usually complain that they are having thyroid problems, and most common is basically the weight gain. Now, how is thyroid diagnosed? Usually thyroid is diagnosed by blood test. Like I mentioned earlier, thyroid antibodies are checked and thyroid function tests are usually checked, and then the doctor has to treat you depending upon whether you have hyperactive thyroid or hypoactive thyroid, that is underactive or overactive thyroid. Also, if you have noticed that there is swelling in your neck, then you should get a thyroid ultrasound, because if there is any nodule or cyst or mass on your thyroid gland, that needs to be checked whether it needs to be biopsied or not. Once you are diagnosed with thyroid problem, there are a lot of treatments available for thyroid problems. There are thyroid hormones that are commercially available, as well as there are thyroid hormones that could be compounded according to your blood test levels. So talk to your doctor about thyroid diagnosis, thyroid antibodies, treating your thyroid and normalizing your thyroid. And once your thyroid is normal, then you start feeling better. I think that's enough for today, and we'll see you again next week with another topic.